Good evening. I'm Psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now, in its 28th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, you may call me in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I got several email questions this week. Let's get started with our first one. It reads, Dear Dr. Fawver, is there a link between fibromyalgia and ADHD? Can Ritalin help for fibromyalgia, fatigue, and brain fog? If my primary care doctor doesn't think it will help, but I'm still curious, what are the next steps I would take? Well, if your primary care doctor is kind of vacillating one way or another, you could always check with a rheumatologist. Rheumatologists typically are the experts in fibromyalgia. If there's a rheumatologist specialist to whom you could be referred. But ADHD and fibromyalgia, they're entirely separate phenomena. ADHD, by definition, starts when you're a child. The diagnosis of adult onset ADHD is an oxymoron. It doesn't happen that way. If you have ADHD symptoms that occur as an adult and have their onset as an adult, typically it's related to some other phenomenon, such as menopause, depression, hypothyroidism, something else is causing you to have trouble with distractibility and attention span. So ADHD is something that occurs since you're a child, and it's there more days than not, and it's going to be more prominent when you're undergoing times of cognitive challenge, such as academic stress, new job expectations, and so forth. So ADHD is one phenomenon. Fibromyalgia is an entirely separate condition that affects women 8 times more than men. It's something that we've known about for several decades now. It's better understood because now we know that with fibromyalgia, there's a particular chemical called substance P. P as in pain. Substance P increases in the brain, on the side parts of the brain where sensory input is perceived, and with higher amounts of substance P, it just gives your nerves an itchy trigger finger, and you have more aches and pains, you feel fatigue, and it'll give you this mental fogginess that goes along with it. So what are the FDA-approved medications out there for fibromyalgia? Well, we just this month had a brand new FDA-approved medication that's been around for several years, but it got FDA-approved as a sublingual under-the-tongue medication called cyprobenzaprine. And cyclobenzaprine is a medication that we've known for years as a muscle relaxant called Flexeril. Flexeril is a tablet, 5 to 10 milligrams every day. We've used it off-label for fibromyalgia, but Flexeril is cyclobenzaprine, and you would take it at nighttime. What it does, it better normalizes the sleep. It gives you better sleep efficiency. People with fibromyalgia typically have less efficient sleep. They don't go into a deep sleep, and when they lack a deep sleep, they're more sensitive to pain the next day, and presumably the higher amounts of substance P in the brain. So cyclobenzaprine allows you to have a better quality of sleep overall, and that's why it's now used for fibromyalgia on a regular basis. A second medication that's FDA approved for fibromyalgia is pregabalin, also known as Lyrica. Lyrica will dampen down the effect of substance P, but it also decreases the itchy trigger fingers of the nerves themselves. Pregabalin's been around for a long time as well and is now generic. A third medication that's FDA approved for fibromyalgia is Cymbalta, duloxetine. It will increase serotonin and norepinephrine in the spinal cord, and in doing so, block the pain impulses coming up the spinal cord, and in doing so give you less sensation of pain. And then finally we have milazepam, which is Savella. That is a medication that also increases serotonin and a little bit more norepinephrine than Cymbalta, but in doing so is more energizing and activating. Now, off-label medications that have not been approved for the fatigue to which you referred related to fibromyalgia will be medications like modafinil, or also known as Provigil. That's a medication that will tend to be activating and energizing. It's increasing norepinephrine and dopamine in the frontal lobe, but it also increases histamine and allows you to feel more awake. Nuvigil is its chemical cousin. Those medications are wakefulness medications. They can be used when people have sleep apnea. And when people have sleep apnea, the best way to treat the sleep apnea is by mechanically enhancing the airflow into the lungs. But if you still have residual sleepiness, you can use medications like, to use the trade names, modafinil or Provigil as well as Nuvigil. So these are medications that are often used as well for fibromyalgia related low energy, and they can help with the concentration and focus somewhat as well. But fibromyalgia is still something that's getting well studied. I'm glad to hear there's a new perspective on how you can treat it with cyclobenzaprine being FDA approved in August of 2025. Thanks for your email. Let's go to our first caller. Hello, Jim. Welcome to Matters of the Mind. Jim, you want to know, how does alcohol withdrawal affect the brain, especially when quitting cold turkey? When you're using alcohol, Jim, what you're doing is you're enhancing a particular chemical called GABA. Now, you've got this teeter-totter effect in the brain. You've got GABA, which is the brakes, and you've got glutamate, which is the accelerator, okay? And the brakes and the accelerator ought to be in balance. When you're using alcohol, you're particularly pushing down on the brake, and in doing so, it gives people a calming effect, and secondarily can actually increase dopamine for some people, and that's why they feel good and happy when they're using it. However, when you withdraw from alcohol, that teeter-totter effect starts to reverse, and there's less GABA being affected, and you'll have difficulty with the enhanced effect of the glutamate itself. So you can have a heavier effect on the glutamate side, so to speak, thinking about a teeter-totter with less of the GABA effect. Higher amounts of glutamate will make you agitated, can give you insomnia, sweatiness, seizures, all sorts of bad things. So that's why alcohol withdrawal potentially can be dangerous. It typically occurs over the course of 5 to 7 days, and it should be monitored and supervised in at least a setting where you have a clinician involved. Sometimes it can be done as an outpatient. Many times it's done on an inpatient setting, depending on the severity. But we often will use other medications that affect GABA, like the benzodiazepines, as a means of slowly tapering somebody off of alcohol. We do indeed use other anti-seizure medications, such as gabapentin, also known as Neurontin, and Topamax, topiramate, are being used to ease the effect of alcohol withdrawal. What do they do? Well, again, they affect glutamate or GABA in ways that will ease the withdrawal itself. So alcohol withdrawal is related to an imbalance of glutamate and GABA, and in doing so, you're going to have excessive glutamate transmission. With excessive glutamate transmission, you can have all those activating, energizing symptoms such as seizures, which is a condition that can be related to excessive glutamate transmission. Thanks for your call. Let's go to our next caller. Hello, Karen. Welcome to Matters of the Mind. Karen, are you there?
Yes, I am.
Hello,
Hi.
Karen.
This is Karen. I called you last week with my switch from Prozac to, what'd you tell me, Tofranil?
I was actually recommending for you, Karen, several options, but quite frankly, my favorite option, just in briefly talking to you, would be the possibility of changing from Prozac to Trileptal. Not Trileptal, but to Trintellix.
Trintellix. Yeah. I'm sorry. You know, I have attention deficit. My brain.
Well, it is late in the day too, Karen.
Yeah,
so.
My brain went for a little whatever. Okay, so I did get that from my doctor, but she gave me absolutely no instructions as to how I'm supposed to do it. When I picked it up from the wonderful pharmacist at CBS, she said, whoa, well, you can do direct switch or taper and switch, and kind of explain both. But she said, because Dr. Fawver is so cool, why don't you ask him what he prefers? She has what you can do, but he would have more knowledge of how he has done stuff like this with his actual patients. So you are the man today.
Well, I could give you some general ideas about Trintellix and coming off of Prozac in that way. I gave you several options with that changing from Prozac without getting withdrawal. And you've done so well on Prozac for so many years, Karen, so you don't want to lose that benefit. But it was brand name Prozac, as I recall, that you had been getting for decades, and now they quit manufacturing brand name Prozac in Taiwan back in December of 2024, so it's just not out there anymore. So what do? Well, that's where you can go with Trintellix as one of the options. Now, Trintellix has a long half-life similar to fluoxetine or Prozac. So both of them have long half-lives. What that means is that you can take the medication every day, ideally, but if you miss a dosage, you're not going to have significant discontinuation or withdrawal symptoms from it. That's the advantage of Prozac. That's the advantage of Trintellix. Trintellix, I'll tell you how that works, Karen. I'll just give you some generalities here. About 1 out of 5 people on Trintellix take it at 5 milligrams a day. About 3 out of 5 people will take it at 10 milligrams a day, and the other 1 out of 5 people take it at 20 milligrams a day. When Trintellix was first studied, everybody in these clinical trials went right up to 20 milligrams a day. But in our experience, in my practice, I just found that most people don't need to go to 20 milligrams a day. That was actually excessive for a lot of people, and they got kind of irritable and overly activated. So what I would suggest, quite frankly, with Trintellix, start 5 milligrams a day for a couple weeks. That's what we would often do. And the goal dosage being 10 milligrams a day. If you're pretty good at 10 milligrams a day, fantastic. If you need to go to 20 milligrams a day, that's okay. So 10 to 20 milligrams a day is where most people will be. And in doing that switch, Karen, what you would do is you could abruptly stop the fluoxetine. You might think, oh my goodness, how could you abruptly stop any medication? Well, with a fluoxetine, you can abruptly stop it, and it will slowly get out of your system over a couple of weeks. The reason I mentioned Trintellix being used at 5 milligrams for a couple of weeks is you have to account for the fluoxetine or Prozac still being in your system, because both Prozac and Trintellix have similar mechanisms of action on serotonin. It's just that Trintellix will also positively affect 5 of the 14 different serotonin receptors. And for you, you'd mentioned having attention deficit disorder. I think for you, you might have actually noticed that Trintellix will be more preferable for you than the brand name Prozac was, because it's going to help some of the ADD symptoms as well. So I would certainly suggest 5 milligrams a day for a couple weeks and going to 10 milligrams a day thereafter, maybe for a month, and then possibly going to 20 milligrams a day. But keep in contact with your primary care clinician to oversee what kind of things you're doing with that. Biggest side effect early on with Trintellix can be a little bit of nausea. Peanut butter is one of the best ways I've ever heard of getting over that nausea. Goes on for a week or two typically, then people get used to it. The nausea is also dose related. So the higher the dosage, the more nausea you can have. That's often early on, and within about 2 or 3 weeks, it often will subside. I wish you the best, Karen. Thanks for calling. Let's go to our next caller. Hello, Craig. Welcome to Matters of Mind. Craig, you want to know what are the signs of someone is a psychopath and when you should be concerned. Basically, a psychopath is somebody who enjoys another person's pain, okay? They're very selfish, they're self-centered, but they don't. It's not that they don't care about other people's pain. They actually enjoy watching people suffer. Now, there's been a lot of speculations on why this happens from a neurobiological standpoint in the brain, because they don't seem to have a connection with other people. They can't empathize with other people. And there's certain parts of the brain involved in empathy where you can actually have that emotional connection with somebody else and understand how they might feel. But the thing about people with antisocial personality disorder and what we call psychopaths will be that they have decreased activity, not increased activity, but they have decreased activity in the amygdala. The amygdala is in the front part of the brain here on the temporal lobe. That's the part of the brain where you have anger, fear, anxiety, and it's actually dialed down. So these people get less anxious, less fearful when they are perceiving they might be in compromising consequences, because in many ways it's a pathological condition, but they pathologically enjoy the perception of watching another person's pain. And I think it's certainly a mental health condition of some type. I think for many people who have that type of personality disturbance, they have traumatic childhood experiences going back to before they were 8 years of age. I mean, when you're in early childhood experiences can certainly shape your personality later on, especially with your bonding. So these people who are psychopaths, or they have antisocial personality disorder, which are somewhat connected, they often have a lack of strong relationship with their mother or father. And you can look at some of the more famous psychopaths throughout history. They often had little connection, if any, with their parents. And that has a big impact on them, because if you don't have much of a connection with your parents at an early age, you then don't develop empathy and bonding with other people later on. So there is a carryover effect like that. Your brain is is hardwired to a great degree prior to the age of 8 years of age. So if you have traumatic experiences before 8 years old, it can really hardwire you and make you susceptible to later problems. So that's why it's very important that we watch out for kids who are at risk when they're young children. Thanks for your call. Let's go to our next caller. Hello, Maud. Welcome to Matters of the Mind. Maud, you had mentioned that your granddaughter confided in you that she feels paranoid that everyone's out to get her. Any suggestions or medical avenues to pursue? Have her maybe keep in contact with her primary care clinician. If she's under 18 years of age, that would be a pediatrician. If she's between the ages of 16 and 24, Maud, and she's having those kind of feelings, I'd certainly want to get her in to see a mental health clinician. Schizophrenia is a condition that has as premorbid symptoms paranoid thoughts about other people. People with schizophrenia will often have deteriorating hygiene as adolescents. They will have social anxiety that's crippling. They will have difficulty with concentration. Their academic performance will deteriorate. Their social interactions will tend to go downhill. So people with premorbid symptoms of schizophrenia can show those symptoms as adolescents. Now for women, the typical onset of schizophrenia can be as late as 24 years of age. For men, it's often 16. Women are a bit protected by estrogen, so estrogen will delay their onset of schizophrenia symptoms. But schizophrenia is a condition where not only do people many times feel paranoid, but they start being able to hear voices when there's not people around. They will get delusional and have fixed false beliefs about the perceptions of others. They will have difficulty processing their thoughts, but they have a lot of trouble with being able to connect with other people. And those are the symptoms of schizophrenia, and that's something that needs to be treated sooner rather than later. So really depends on her age, Maud, but I'd certainly get her to be seen by her pediatrician if your granddaughter is under 16 years of age, between 16 and 24 years of age. Ideally, have your granddaughter see a mental health clinician of some type to really keep a close eye on her to see, okay, if she's paranoid about other people because she has some social anxiety, it's more of a reflection about herself, or is she getting to the point where she's delusional with fixed false beliefs and getting extremely frightened about the intentions of others that are unrealistic? So I'd certainly get her assessed very carefully, especially if she's between 16 and 24. Maud, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, do anxiety and inflammation coexist? If so, how do they affect the brain? It's an interesting correlation because anxiety, as I mentioned, has its heart right here in the amygdala in the temporal lobe, and that's the heart for anxiety, anger, rage. People can have that part of the brain fired up by inflammation. Now, what are the two main factors for inflammation? Well, the two main things that cause inflammation, and a lot of this was discovered during the COVID pandemic with all the restrictions, but the two main things that seem to cause inflammation in the brain are loneliness, and insomnia. So loneliness and insomnia are two big precipitants for inflammation. So what can happen is you get in higher amounts of anxiety there, and when you have higher anxiety there, you get this high amount of anxiety in the anterior cingulate gyrus on the inside of the brain. So it's the front part of the brain looking at you. The anterior cingulate gyrus is the part of the brain where you're thinking, is this a good idea or a bad idea? And you're kind of weighing the pros and cons of different decisions in your life. And the problem with anxiety, it will cause that anterior cingulate gyrus to really get fired up. So you start ruminating. And you start thinking good or bad, good or bad, good or bad on everything you're doing, and it paralyzes you because you can't make a decision because you're so ruminative. That part of the brain gets fired up when you do have inflammation. And when that gets fired up, this part of the brain called the basal ganglia, which is down here below, down here below, the basal ganglia starts to shut down. When the basal ganglia shuts down, you get really tired and fatigued. So symptoms of an inflammatory process in the brain will be fatigue, low motivation, lack of enjoyment with things, and poor concentration. These are all a cascade of things that can suggest inflammation. Why is that important? Because it might influence what direction we go with our treatment. So if we see somebody who's fatigued, they can't concentrate, they have difficulty with motivation, they don't enjoy things, we might go with a medication that's going to more affect glutamate than it affects something like serotonin, because with the serotonin medications like Lexapro, Zoloft, Paxil, they don't affect inflammation as potently as a medication that increases glutamate might do so. So with the medications that enhance glutamate will be Spravato as a nasal spray. We use Auvelity as a capsule for people, or as a tablet for people who are trying to enhance glutamate. And of course, ketamine, which has been around as an anesthetic since the 1970s, it's been used off-label for the past 25 years as an injection for depression. So Spravato as a nasal spray, Auvelity, and ketamine are all means by which you can enhance glutamate transmission. And enhancing glutamate transmission appears to be directly and specifically very potently anti-inflammatory. So that's why it's important for us to sort out if somebody's having the symptoms of inflammation. But inflammation and anxiety certainly can go hand in hand, and that's how they're affecting the brain. Thanks for your email. Let's go to our next caller. Hello, Felix. Welcome to Matters of the Mind. Felix, you want to know, is compulsive lying a mental condition or a symptom of a disorder? It's difficult to say, Felix. I think you'd have to look at the circumstances. When people are compulsive liars, number one, they're trying to make themselves look good in the presence of others, and they're trying to save face, basically. And in doing so, okay, they're trying to get out of a certain situation. Compulsive lying means they know they are lying, and in doing so, it can affect your overall mental health, being a compulsive liar, because the problem with compulsively lying is you have to stay consistent with your story, and many people who are compulsive liars have difficulty with variations of their stories. They get called out on it. It starts to have social consequences as well as mental health consequences. So I wouldn't say compulsive lying itself is a symptom of a disorder as much as it's a precursor to mental health conditions, because the lying itself, which might have started somewhat innocently to avoid consequences of certain behaviors, you start to get used to doing it, and the next thing you know, it becomes a way of life for you, and it becomes part of your character and actually part of your reputation. So as you're called out on the compulsive lying itself, you're known from a reputable standpoint of being somebody who can't really be trusted. So that's always problematic. Felix, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, why has Effexor made it so much harder to reach climax during intercourse? I love everything about it. Besides this side effect, this nasty side effects if I accidentally, and it has nasty side effects if I accidentally miss a dose. Effexor is also known as venlafaxine. It's a medication that predominantly will increase serotonin and secondarily norepinephrine. As you go to the higher doses of 225 milligrams, you get more of a norepinephrine effect. But that serotonin effect will dampen your sexual drive. The sexual performance will be dampened. That can go with any serotoninergic medications. Now, a way to get around that, you mentioned you really, really like the Effexor for that reason. I mentioned to Karen earlier, there's a medication that enhances serotonin, but does so in such a way that it doesn't cause sexual disturbances. And as I mentioned to Karen earlier, Trintellix would be a possible alternative for you. So Trintellix is going generic by the end of 2026, so it's getting cheaper as time goes on. But with Trintellix, you're going to get the benefit of the serotonin effect that you're getting from the Effexor, but yet you're not going to have necessarily the sexual disturbances that you'd see with Effexor. Trintellix was compared to Lexapro head-to-head to see if it would cause the same degree of sexual disturbances as did Lexapro, and it did not. So Trintellix in clinical trials showed that it didn't cause the sexual disturbances as much as the serotonergic medication. And secondly, in my experience with patients, it doesn't seem to cause the sexual disturbances. So Trintellix, also known as vortioxetine. Vortioxetine is the chemical name. That might be an alternative for you. Thanks for your email. Let's go to our next caller. Hello, Jerry. Welcome to Matters of the Mind. Jerry, you want to know is at what age do depression symptoms start to develop, and what are the warning signs to look out for? Jerry, you can have depressive symptoms as a child, and starting as an early child. Let's go back to before the age of 8 years of age. If you had a lot of traumatic experiences as a child, sexual abuse, physical abuse, parental divorce, emotional abuse, a parent was in jail, a parent had mental health issues. If you had the exposure to certain emotionally traumatic circumstances before the age of 8 years old, you are at a higher likelihood later on to have anxiety and depression. And what they did is they took the 10 most likely traumatic events as children, and they put them all together in a scale called the ACEs scale, the Adverse Childhood Experiences scale, which is free. It's something that's online, and if you have over 4 of those 10 symptoms, it puts you at a higher risk for having depression and anxiety later on. So there are precursors for depression from a social standpoint. Genetically, depression is about 1/3 genetic, so it does run in families, but it's only about 1/3 genetic. Later on, well, there's different things that can provoke depression, bad stuff happening, traumatic experiences, you bet. Alcohol, marijuana can often bring it out if it might not have been there before. Some people don't have their first onset of depression until, like women will have a baby and they have their first onset of bad depression with a postpartum depression. Men can have depression at retirement because they lack purposeful, meaningful activity in life. So you have all these different factors that it can occur. So you can have depression starting early on in the early years. You can have it starting later years. One of the first symptoms of depression I often hear about, Jerry, will be a little bit of social withdrawal and insomnia. So difficulty with sleeping, withdrawing, and not doing the things you really enjoy. Getting rid of those purposeful, meaningful activities and getting more withdrawn, those are often big symptoms of depression, Jerry. Jerry, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.